I associate myself with the comments of Ranking Member Frost, and I just want to point a few things out. If we don't extend these tax credits that are going to expire at the end of the year, in Illinois alone, 500,000 people who receive these tax credits will see, on average, their premiums go from $260 a month to $464 a month, almost an 80% increase. Looking closer at these numbers, those living in urban areas will see an almost 90% increase in premiums, whereas people in rural areas would see premiums rise by a stunning 107% on average, so doubling their premiums. Let's be clear, people will not stop needing medical care. Safety net and rural hospitals will pay the price. Patients will still show up in emergency rooms, but only after manageable conditions have become catastrophic, driving the cost of care through the roof for everyone, no matter their insurance status. Listen, this is not theoretical. In safety net hospitals across Illinois, frontline providers have warned me directly. The Republicans' big, beautiful bill, or what I call the large, lousy law, includes Medicaid and ACA cuts that will drive up costs, slash essential services, and push struggling communities into healthcare deserts. At Loretto Hospital in the Austin neighborhood of Chicago, 83% of patients rely on Medicaid. In the face of Republican cuts, hospital officials told me they may have to close programs to ensure they don't have to fully shutter the hospital. In Benton, Illinois, which is in southern Illinois, I visited Franklin Hospital, where a fifth of the hospital's budget comes from Medicaid reimbursements. Republican Medicaid cuts will require them to provide care, quote, on a smaller scale so they can continue serving their rural community. On top of that, leadership at Franklin Hospital told me that if the Medicaid cuts are significant enough, they would have to reduce staffing and reevaluate the services they can provide, and this will affect the entire rural economy. Republican healthcare cuts are going to close essential hospitals, and this is a map of 11 hospitals in Illinois that are set to shutter. It's going to hurt everyone because it doesn't matter what healthcare status you belong to, health insurance status you belong to. If you use any of these hospitals and if they close, you will be negatively impacted. And so that's why we need to be concerned about this expiration of tax credits at the end of the year, but also the implementation of the large, lousy law, because it will lead to a crisis in healthcare that is eminently preventable today. If we can just marshal our energies and collective resources, we can pass an extension of the ACA tax credits and prevent what would otherwise be a catastrophic situation for millions of Americans.